Hi, good day everybody. So today what we are going to do is vital signs. Vital signs includes temperature, pulse, respiration and blood pressure. So first we are going to introduce ourselves to our patient. Hi, good morning. Could you please tell me your name?
Jane,
Hi Jane, good morning. My name is Miss Mohes. Are you okay today?
I'm fine.
Good. So what we've come to do your vital signs, which includes temperature, pulse, respiration, and blood pressure. Is that okay?
Yes, that's fine.
Good. By chance, do you have any pain?
No,
0 being no pain and 10 being the most. How is your pain?
0.
0. Great. So I'm coming now to go and do your blood pressure, okay?
Okay.
Good. So first, we got to gather our equipments for our vital signs. Equipments for temperature includes a thermometer, which we use mercury thermometers. You need non-sterile gloves. You need additional PPEs, and you need your documentation, which is your clinical chart. Okay, which is this. Obviously, different hospitals have different clinical charts, so you will use what your hospital uses. Okay. On your tray, you will have dirty, wet swabs and dry swabs. So first we are going to do temperature. So you pull your thermometer. This is called the bulb and this is the tip. So once the thermometer comes out of the container with the solution, this is considered clean. And then this is dirty. So we need to obviously use a wet swab and clean from the least contaminated to the most contaminated. And then you take this and put it in your dirty. You obviously dry, because you cannot put a wet thermometer under the patient's arm. Okay? Now you need to look at your mercury. Your mercury in the thermometer is the silver line in it, right? So you make sure that that is below 35 degrees. So if it is not below 35 degrees, we are going to flicker our hands to make sure that it goes below 35 degrees Celsius. So it has gone below 35 degrees Celsius. Now we are going to put the thermometer under the patient's arm, which is the auxiliary temperature we are going to take. So you're going to tell your patient to raise the arm, and under the sink of the arm is where you're going to put your thermometer. So you put the thermometer and you bend your patient's arm, leaving the thermometer there for at least 3 to 5 minutes. Okay? During this, while you hold your patient's arm, you feel we're moving on to the pulse. So with the pulse, you need a second hand watch. Well, a watch with a second hand, okay? You need your pencils, you need your gloves, which you would have had on already when starting your temperature. So you feel, take your 3 fingers from the thumb, you slide all the way down for the radial pulse. You feel for your radial pulse, you look at your watch, and you check the beat for 1 minute. Okay? So we look and we check the beat for 1 minute. When you finish checking your pulse for 1 minute, we are going to move on to respiration. Again, you will use your watch with your second hand and you look at the rise and fall of your patient's chest, keeping your fingers by the pulse. Because we don't want the patient to know that we are looking at the rise and fall of the chest, because if they know this, obviously they will start to breathe differently, okay, or faster. So we don't want this. So we'll keep their hand there, hold the pulse, and you look at the rise and fall of the chest for 1 minute. When we have finished this will take us to about 3 minutes. We will come back to the temperature, take out the thermometer, which side will be considered dirty now? So your dirty would be under the arm, yes? And this is the clean. So you are cleaning from clean to dirty. Least contaminated to most contaminated. You always dry. And now we'll look for our reading. So you look at the mercury, which is the silver lining, and you take a reading. So her temperature is 36.6 degrees Celsius. And then we put it back into our container, right? You will then go on to your documentation at this time, and you will document it in your patient's notes. Then we'll move on to blood pressure at this point. Hi, Mrs. James, are you okay?
I'm fine.
Good. So now we are going to move on to blood pressure. Is that all right?
That's fine.
Great. So with blood pressure, you would need your stethoscope, okay? With your stethoscope, this is called the bell, this is called the diaphragm. You would need your manual blood pressure machine. You would need the correct cuff, if need be, and you would need your alcohol swabs to clean the area, to clean your stethoscope, okay? Great. So now we are going to move on to blood pressure. So we are going to put the cuff onto your patients. You can just read the cuff and you will know how to put it on, okay? The markings and so forth. So where the artery is, you're going to put it where the patient's artery is. Make sure the patient's arm is resting. Good. You feel for the radial pulse. Right? You feel for the radial pulse, and we are going to pump until we stop feeling the radial pulse. All right? So we are going to pump. Make sure that your valve is closed. There we go, you see? So now the valve is closed. I'm pumping until I stop feeling my radial pulse. So I stop feeling my radial pulse at 160. Okay, I am going to release the pressure. When I release the pressure, I am going to wait for 1 minute for the blood to flow back into the patient's arm, and then I will continue taking the pressure, okay? So my 1 minute has up. Remember, I went up to 160, so you always add the 30 to the 160, all right, which works out to be 190. So I palpate the brachial pulse and I put my diaphragm by the brachial pulse, okay? Then I'm going to pump all the way to 190. Make sure your valve is closed and you pump all the way to 190. And you slowly release, listening for the top, the first beat, which is your systolic, and you will hear a constant amount of beats. You listen for the last one, which is your diastolic. Okay? So what I heard is 140/60 millimeters per mercury. And that is your blood pressure. You then will remove everything from your patient. Thank your patient for allowing you to do the vital signs. If the patient wants to know their blood pressure, it is their right for you to tell them so. You will then come and you will document in your chart what all your findings. Okay? So you will document your temperature, your pulse, your respiration, and your blood pressure. Right? And that comes to the end of vital signs.